Hi nurse friends, you're now watching Nursing with Faith. This video is on 10 ways on how to be successful in clinicals. These are the 10 ways that work for me, so I just want to share with you guys what I have done and what I do, again, to be successful in clinicals. So number one is to always be on time. Being on time, knowing the earliest time that you can actually come and start your clinical paperwork in the morning gives you ample time to really look into your patient's chart and to kind of relax and breathe, not feel rushed, and to just think things through and kind of plan and build yourself up to get onto the clinical floor. So always be on time. Number two, always be prepared. Always be prepared, meaning have your clinical bags packed and ready with your stethoscope. Required clinical items are your stethoscope, your pen light, your bandage scissors, your blood pressure cuff if you take if you're supposed to be taking manual blood pressures, and all your clinical paperwork, you know, your SBAR paperwork if so, medication, index cards, lab interpretation, packets, and papers, pens, any resource books like your like RNOTES. That's my number one go-to resource book. Your drug guide, your care planning book. Just have all your things prepared and ready. Try not to leave things at home because it just inconveniences yourself. And you always want to be prepared when a teacher comes in and they ask you, as you're doing a physical assessment on a patient, have you listened to the patient's lung sounds yet? That's what the teacher would ask you. Have you listened to the patient's lung sounds yet? And you'll be like, oh no, I left my stethoscope at home. I have to go borrow from Susan. You always just want to be prepared. So build yourself to be always prepared. Double check the night before. Make sure you have everything. Okay, and if you take something out, or if you even make a checklist every time to make sure everything's in your bag, especially if it's a habit of yours to always leave something at home, you always kind of forget to put your pen light back in your clinical bag after clinicals, make a checklist. Type out a checklist on Microsoft Word, or whatever you use, print it out, and the night before clinicals, or the week, like the beginning of the week, to prepare for clinicals, make that checklist. Check, 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 and make sure everything's in there. Number three, read the progress notes. Read the progress notes that are in the patient's chart. I do that. For me, it lets me know what the doctor has said and why the patient is in the hospital. Progress notes can be broken down into admission notes, and I like to read the situation that actually happened the same day as to why the patient came in. So when I'm filling out my SBAR, sometimes it's easy to just fill out the SBAR and not actually read what you're doing. Sometimes it becomes just a habit or just a routine to just write out the patient's vitals, write out the patient's lab values, write out their diet and everything. You're not really thinking about why is the patient's diet like this? Why is the patient's activity level, activity like this? You must read the progress notes. So do yourself a favor, and it'll inform you about your patient so that you can write a care plan effective for this patient, and so that you can care for this patient effectively. Number four, keep RNOTES with you. And RNOTES is a little small booklet. It's a spiral book, very small. It fits in your scrub pocket. It fits in my scrub pocket. You carry it around, and it's broken down into things that an RN or a nursing student needs to know. Certain procedures. It breaks it down on a small, about the size of an index card. All IV administration, medication administration, NG tube insertion, emergency medications, injection sites. And the book is about this big, I want to say. And I got it on Amazon. Don't quote me, but it was in the $20 range, and it's my resource. It's my holy grail in nursing school. And I bring it to class, I bring it to clinicals, and just anytime I really need to use a resource, say one of my patients comes in for angina and I really need to, look up something for angina like a heart medication, or understand why this patient is on a heart medication, or, the teacher challenges me to do an NG tube insertion, or something along that line. I need to be refreshed on dressing changes. Clinicals get so crazy sometimes that you can't always run and go use the computer and look up how to do a dressing change again. You know, just use a pocket just for your RNOTES, so you can pull it out, go straight to the page. It has tabs that'll help you to find what you're looking for. You can also write on it with pen. It wipes off, and it's just a very helpful resource. So I recommend that to you guys. Number 5, compile questions for your nurse. In the morning, when you get there on time, when you're going through your patient's medical record, make sure that you write down a couple questions for your nurse, because when you do get report on your patient, before you actually go in and take care of your patient, do your assessments and vitals, make sure you ask pertinent questions during report. That just allows you to, that kind of like boosts you up to go into the patient's room, that kind of just even think of any questions that you could possibly, that would possibly probably come on your mind, come to your mind during the clinical day. Just think of like 2 or 3 questions. You can even ask your teacher too. So find questions for your nurse, for your teacher, before you get on the clinicals floor. It makes things easier. Like if you don't understand anything, just make sure you get that out of the way. Number 6, prioritize your time. This is self-explanatory. When you have 2 patients, one of them is going to be more critical than the other. In some cases, both of them will be critical at certain times. So you just kind of have to prioritize your time. Pain meds over this patient needing to use help using the urinal. You just kind of have to debate, prioritize your time, call the tech to help the patient use the urinal, things like that. So prioritize your time with your clinicals, even with, doing your vitals, your physical assessment, anything you need to do, just prioritize your time, and you get into the swing of things and the hang of things as your semesters go and the more experience that you have. Next is work as a team. Work as a team always. You have classmates there. If you're not able to give a patient a bath because your second patient or another patient that you have is needing medications administered, or needs a focused assessment, or something occurs, and you have students there. If somebody's not doing anything, just ask, hey, my patient in 23A, I'm not able to get to a bath right now, can you please do it for me? Work as a team. Ask them questions. Use them as resources. Work together. It makes nursing school a bit easier. 8, write yourself a checklist. During clinicals, I always write myself a checklist on the bottom of my S-bar, and I say, I bullet them. I say, bullet vitals, bullet physical assessment, bullet charting, bullet INOs. I just bullet certain things that I know that I need to do, and I check them off. If I have to do it more than once during the day, as far as like charting or something like that, all right, 9 a.m. Check, and 12 a.m. check. I just keep myself up to date on what I need to do, what I have done. Write yourself a checklist, because clinicals gets very busy and you get bombarded. The teacher will come and ask you to do an IM injection over here, give insulin over here, because your patient's sugar was too high. You have to be able to manage a lot, because a patient's condition can change in literally 10 seconds. So always write yourself a checklist of things that you need to do, have done. Keep yourself in check, okay? Next, number 9 is stay organized. Self-explanatory, stay organized. Keep your pens where they need to be, keep your papers where they need to be, books, anything. Just keep yourself organized, know where things are, just because everything else is confusing. Again, you want to just make sure your mind is set on what needs to be important, and you don't want to be digging in your pockets looking for this important paper that you wrote the patient's vital signs on, and you can't find it. You think you dropped it, and it's really just crumpled up in your pocket. Just stay organized. Get a clipboard. I have a white coat. I want to say it's a white coat clipboard. I don't have it with me. I'm not home. It folds in half and has a reference on the back of the clipboard, and you can just stick it in your scrub pockets. And I put my S-bar, my lab packet on it, and I put things that I need on it. And last but not least, check on your patient frequently, because again, their condition can change very quickly, and you just want to keep up with your patient because you are the nurse, and you know their pain levels may change. You want to make sure that they're using the bathroom on a, you know, and this is all things that are as the nurse can do, as far as the nurse is able to do. You know, so it's not that you know, you're not going to go in the room every 30 minutes, but as far as you can do, or your limitations will allow you to, because I know how it is. So just make sure, you know, their pain is controlled, potty is being done, whether it's the urinal, the bedpan, help to the bathroom with the walker, assist, you know, and, you know, let me not say use, but utilize a tech, you know, because you, the nurse, have to take care of their pain and take care of what the problem is. And I'm a tech myself, so I'm not, you know, downgrading or nothing by any means whatsoever. I am a tech, a nurse tech myself at a hospital. Utilize your tech, and, you know, for things that you are not able to do, not just for anything, but just for things that you are not able to do as a nurse because you have important things to do. So these are 10 ways that I am successful in clinicals. I have 1 semester left, and then I will be done, but this last semester I'm gonna, again, utilize my 10 ways on how to be successful. I'm learning the ropes more and more as I go, and I'm getting used to doing things more as I go, so I thought I'd share my 10 ways on how to be successful with you guys. So I hope that you guys take something from this, and if you have ways that you, on how you are successful in clinicals, and you'd like to share it with me, please do. Please feel free to drop it down in the comment box below, and don't forget to subscribe for more. Bye.